Okay, guys, so let's start with anatomy of heart. Our heart is natural pump of our body, right? It pump blood. We all know that. Let's just go through the basic aspects of the heart. Just weigh around 250 to around 350 grams. Like you may wonder, the maximum amount of the range about how much a heart could weigh is recorded as 90 to 650 grams. So it just vary depending on the age and basic physiology and basic anatomy of the person, of the individual. Like land, but the size of our heart is usually correlated with the size of fist, just around the size of fist. Obviously, it may increase or decrease depending on where situation. Like like in a situation where a patient is athletic, size will increase due to increase in function. There is hypertrophy of heart. Yes, or for example, a patient have acromegaly. In that stage, this situation become false, as patient may have large fist, but size may not correlate. So it's just a basic correlation of the size of the heart. So what about the shape of the heart? Shape of the heart. It is explained something like a blunt cone, or I personally prefer a pyramid. A blunt cone or a pyramid. Why I draw it like this and not like this? That's because our heart not present in a normal up-down situation. It's not how that's not how our heart is actually placed in the body. So let's just understand how our heart is placed in our body. So this we know a normal thorax with a rib cage. So here we can say these are our clavicle and our normal rib cage. So when you have a patient or how you record out the basic outlines of your heart. So let's just say the superior border of heart, which is let's just first see this is the left side and the right side. Always remember the sides of the patient will always be opposite to what you have. Like it is going to be a mirror image of you. So this is your left side and this is the right side of the patient. We always analyze in the point of view of patient, not in point of view of the operator. Okay. So let's just say superior border of a heart is, say this is first rib, this is second, going to be inferior border of left second rib, or you can say left costal cartilage. So just around here, it is going to be on the right side, it extended into the superior border of third intercostal cartilage, and from there, it's going to follow on the right side up to the sixth intercostal cartilage, right? So the second, third, sixth, it do not extend out in the rib. So what I'm saying is, this is your rib, your sternum basically, and here this part, the right border of your sternum, it overshadow your right border of your heart. So When you are taking an X-ray, the chest X-ray, you can't actually make out the right border of the heart. If you are able to make out, like if you are seeing visualizing the shadow of the right margin of the heart, so basically what you are seeing is a hypertrophic heart. Only in the case of hypertrophy of heart, especially of the right side, you will be able to visualize the right border of the heart. Otherwise, you won't be able to visualize it. It's going to be hidden behind the sternum, under the sternum shadow. On the left side, it is extended up to the mid clavicle level. What is the mid clavicle level? This is our clavicle divided into two parts, and this is the mid clavicle level. And in going to be up to the fifth clavicle, fifth rib, intercostal level. Okay, so from the fifth intercostal level, this is how our heart is going to present in a body. This is just the rough idea. Okay, it's just the rough idea. So the second intercostal, inferior border of second costal cartilage, superior border of third costal cartilage. Okay, so you can just right, and then the third, and this is the sixth, right, costal cartilage, and this is the fifth costal cartilage. Second, third, sixth, fifth. Easy, 2, 3, 6, 5. So, what do we learn about this? Right? Okay. So, this is our heart. This is the apex. This is the right border. And right. This is our heart bed. It is slightly tilted toward the left side. That's why we say our heart is usually positioned in the left and not in the center. But it actually positioned in the center, but it's slightly tilted towards the left. So this is, you can say, the base of the heart, and this is the apex of the heart. So what happens when you want to check the sound of the heart, or just when you have a stethoscope and you want to hear the sound of the heart sounds? So these are the places we need to check the margins of the heart. Or even when you doing the percussion of the chest, you try to percuss the borders of the heart, even then you are going to analyze in these areas. Okay, or in especially when you are taking the ECGs, you are going to place, we are going to discuss all of these things, the heart sounds, ECG, the percussion part, when we will discuss that, you will be able to clearly rule out where actually our heart is present. Okay, so how does a heart look like? This is our basic, the basic anatomy of a heart. This is why I said this is the apex of the heart. This is the base of the heart, and it's positioned as a pyramid. This is the anatomical position. This is where a diaphragm lies. This is here our sternum will be present, right? So this is our sternum. This is sternum, and this is where our, so you can just see mid clavicle line. This is the inferior border of second intercostal space. This is the superior border of third intercostal space. and it's slightly lifted, so it will go around sixth, and this will be around fifth, right? So let's just say we want to rule out the borders again. We are going to remember it simply, very simple. Second, third, sixth, fifth. It is not in this direction, but it is going to be a slightly tilted. That's why we just look at like this. See, this should be superior. This should be superior to this, but not exactly. This is slightly in a tilted situation, right? And then here we will have our sternum, right? And here we will have mid clavicle line, right? So this is the limitation of our heart. Even when you, even when we were going to discuss the uh, lungs, we will. These are all right. These are the apex of the pleural. Then going to extend out to this area from the sixth, then in mid clavicle up to the eighth, then in the back they're about to be in the 12th clavicle lesion, the eighth and the sixth clavicle lesion, and then up to the apex of the earth. This is how our lung going to present like this. In this area, going to the same checking, then there's going to be slightly lung. Here we're going to have a slight lung tissue which is going to be lingula. Don't worry, we will discuss this. Lingula is another organ, another it's present somewhere else in our mandible. We will discuss about that also. And then same 6, 8, 12, and then back. Right. So this is our normal lungs presence. And then here we have a diaphragm. Right. So don't worry, we will discuss them again and again. When we will discuss apnea, we will going to discuss it again. Okay. So when let's just deep dive into our heart. So what all we have here? Okay. So for our heart, then let's just say we have major organs, right? We have four chambers, two on the right, two on the left, right? Right atrium, right ventricle, left atrium, left ventricle. So for a right ventricle and left ventricle, which are supposed to be our major chambers, they they are part of a very huge functionality of our heart. Even our like this is out of the topic, but even sometimes even articles are not able to pump or they are not electrically working. In that state, patient may survive because this is the basic flow. When we discuss the blood flow and the basic cycle of the heart, then I'll explain to you how even when our heart auricles or ATMs are not working, may survive, patient may survive, but without ventricle, we can't. That's how necessary these ventricles are. I'll explain to you in the when we discuss the medicine part and the pharmacology part and the pathology parts of the heart. So this is the apex of the heart, right? And this is the base of the heart, and this is the anterior part, right? So you are actually looking in the front of the chest. This is the anterior view of the heart. So what we have in anterior view of the heart? A larger chunk is made by right ventricle. A smaller chunk is made by left ventricle, right? And what is present in between both of them? Intraventricular septa, interventricle, intraventricle, let's just write it better way, intraventricular septa. You do not have to get confused with the larger names. These are not that much of a problem. It's just intra between two ventricle is an interventricle septa. And when we discuss atrioventricle septa, it's a simple difference between a septa, a division present between atrium of the heart and the ventricle of the heart. This is AV septa, this is AV septa, but this is IV septa. Okay, so most of the names are going to be a direct interpretation only. There's nothing much to discuss about that. This is a right atrium. This is a left atrium. Right. These are we all know very. These are very easy, right? There's nothing to be confused about. What are these? Superior vena cava. This is inferior vena cava. These drain the entire area above the thorax, like from the head and neck area, all drain into this. And this drain the entire lower body. So you just know that your blood is collecting like all into the this vena cava as we used to draw in our simple handwritten diagrams. No, we have vena cava here and here. Same way we also have inferior aorta, superior aorta, right? Those arteries which are supplying lower body, right? And this is we all know our most favorite aorta, right? Ascending aorta, here, descending aorta, ascending aorta because it is ascending upwards, ascending into the head and neck region, right? So now we have discussed the major anatomy, like we all know these. What are these? These are pulmonary vessels, pulmonary arteries, right? And pulmonary veins. We have these are pulmonary veins, and pulmonary artery. So we always get confused about this. Many people ask me, sir, difference between pulmonary vein and pulmonary artery. Let's just write it with different color. Pulmonary artery. Okay, so before that, let me give you a basic idea what does vein versus artery mean. What is a vein? Which is blue in color, could say that, but in anatomy we don't have blue or red color. We can't distinguish in a dead organ. If you have a cross section of a organ, you can't distinguish whether it's artery or vein just based on the color. So how do you distinguish between a vein and artery? Color? No. Thickness? Yes. Diameter? Yes. But what is the main difference between an artery and a vein? A vein drains the blood towards heart. An artery take away the bloods away from the heart. No, artery for away. Yes, vein veins have larger diameter, larger internal diameter, right? Because arteries have muscles within them. There we have muscles in arteries. In veins, we don't have any muscle. That's why our veins are thinner. Wall of the vein, thin walls, thick wall. Muscles absent, present, larger internal diameter, small internal diameter. If we have two vessels of the same outer thickness, you want to know which one is which. You can just look out within the lumen. You can just look out within the lumen. In the vein, you will have larger lumen. In the artery, you will have smaller lumen. Right? So, when you differentiate between pulmonary artery and pulmonary vein, vein is the one which is taking blood towards the heart, and it is taking blood away from the heart, right? That's why even though in this we have deoxygenated blood, right? And this one carry oxygenated blood. This should be the artery, but no, we do not differentiate artery and vein depend on the type of blood it carries, right? So this one take the blood to lungs, right? And this one bring back the blood to heart. So this is pulmonary artery. This is pulmonary vein. That's how you're going to remember this. Okay. So these are the basic differentiation between pulmonary vein and pulmonary artery. So now that we will discuss the blood supply of the heart. Okay. But before that, let's just see what is at the back of the heart. So in this side, if you look at from here, this is the anterior part. And from this is the we are looking at from the posterior. So this is the base, right? So as we all know, a large amount of anterior part. Anterior is basically have a right ventricle, right? Most of the right ventricle and small part of left ventricle, right? But in the posterior surface, we have more of left ventricle visible and less of right ventricle, right? Situation changes, right? So then we are left with the blood supply of the heart. All these arteries are supplying the blood, right? The right coronary artery, right? This is right coronary artery. What does it supply? It supply to right ventricle, right atrium, SA node, AV node, left bundle of his, right, and posterior one third of intraventricular septum from the inside of the heart actually, right? This area and obviously the base part, right? But what in case of left coronary artery? Left coronary artery supply left atrium, same left ventricle, same left and left bundle of his, same anterior to third, this part and posterior on the right. So and the apex, this is common. So it's going to be like confusing. So let me rule out. Okay. Right coronary artery, left coronary artery. Simple out. It's a right. So you're going to supply right atrium and right ventricle, SA node and AV node, right? So RA, RV, SA, AV, right? Simple. And in this side, LA, LV, right? Yani left ventricle and left ventricle. Then right will supply the left bundle of his, but left will supply both left and right bundle of his. This is what you should be able to remember. You should remember it. And it's simple posterior one third and anterior one third of the vertical septum. And then both of them supply the apex of heart. So remember this, can remember this, right? So you can just remember both balance out with each other. If right is supplying the atrium and right ventricle, then left is supply the left atrium and left ventricle. But right get to supply both of the nodes, so left will supply both of the his bundle of his. A small amount of will be supplied by the small amount of left bundle of his will supply by the right coronary artery, and then intervertebral septum will be supplied by both of them in the apex of the heart. So main differentiating part will be SNAV. Question arises what happened when right coronary artery occluded, or if left coronary artery is occluded, which of the organ, which of the part of the heart will be affected, or which will occlusion of which of the artery will lead to disturbance in SA node or any pathology in SA node. So they may ask you, you know, they may ask you in that questions about that, right? So what about the veins? What about the veins of the heart? So for the vein, we have measures. You can say this is a small cardiac vein, right? A small cardiac vein. Then joining these two, we will going to have marginal, right? This is marginal in IV section. This is cardiac vein, right? And connecting with both of them is coronary sulcus, right? And then we will have middle cardiac vein and greater cardiac vein. So I'll make it simple for you. So that's just for veins, right? That's a difficult part to remember, like in graph. So let's just see. You have your heart like this, right? So these are your ventricles, cardiac, right? And this is your eye. So what are the veins? Small cardiac vein, right? It's joining out like this, and then here we will have marginal. This is small cardiac vein. This is marginal vein, right? And this is great cardiac veins, right? And this is middle cardiac vein. So how do we remember this? In this part is coronary sulcus. Coronary sulcus. So you just remember it as a H. This is the simplest way. The one joining the both is coronary sulcus, small cardiac vein. This is greater cardiac vein, and this is the marginal vein. Right? These things, this vein and this vein, this is all part of cardiac, and then the very marginal vein on the margins of the heart. Okay. So this is how you should basically simplified the veins, right? Right. So next what we have is we're done with the base, right? This is their marginal vein. This is marginal vein. Let's deep dive into the heart. Let's cut open our heart, right? So our heart have three layers, right? These are the layers of our heart. Okay. So our heart, outer surface of the heart is epicardium, like how we say epidermis in epi. What epi mean? Outside, outer surface, right? In the middle we will have myocardium. What does myo mean? Middle? No, myo mean muscles. So in this section we will have all the muscles of the heart, all cardiac muscles, cardiac all my muscles and myocytes are present in this layer. And then inside we will have endocardium. Endo mean inside the innermost layer, like how we say endoscopy inside it, right? So this is endocardium, this is myocardium, and this is epicardium, right? But our entire heart is enclosed in a sac around it. This yellow surface, this part, this is known as pericardium. You know how we have a protective layer around most of our organs, like in lungs we have pleura. The same way, this one protects the outer surface of our heart and connects this to our mediastinum. Right? And then within our hearts, we will have our walls. These are all the walls present in the heart. We will have a good discussion on the walls when we will discuss the cycle of heart. Okay, so these are the walls connected by chorda tendinae to our muscles. Right. Okay. So how does our cycle work? Let's just have a discussion like how blood is draining into our vena cava, superior vena cava and inferior vena cava. Right. First blood come into this, then it will be collected into the right atrium. Then this wall. Which one is this one? AV wall. Atrioventricular wall. Right. This atrioventricular wall, AV wall, specifically this wall is known as tricuspid. Tricuspid. This tricuspid wall allow the blood to flow into the ventricle. Which one? Right ventricle. And from the right ventricle, the blood will travel into the pulmonary artery, not the vein, pulmonary artery to lung. From there, this filter blood via which wall depended? Pulmonary wall, right? This is a fourth stop for it. From here, the blood goes lungs. From there, the blood will be collected via pulmonary artery, pulmonary vein, sorry. Blood will be collected via pulmonary veins and will be drained into the left atrium. From here also, blood will be collected via these orifices. It will be collected into the left atrium. Here we also have pulmonary. In this section, we will also have pulmonary valves, which will prevent the backflow of the blood back into the lungs. When this chamber this chamber contact, this will prevent backflow of the blood. From here, blood will travel into the left ventricle. And from the left ventricle, our blood will travel from here to our aorta. This is the arch of aorta, and this is a descending aorta back to body, right? So that's how our blood travel. Don't worry, this is just an introductory part. We will discuss all of these in very detailed section when we'll discuss the basic physiology of the heart. Okay, so don't worry, yeah, just any basic introduction is nothing to be bothered about. A very easy part. This is our cross section of our heart. So like we cut this heart from this section, and this is how it look. This is the bicuspid. That's why we call the middle wall or bicuspid wall. It have two cusp. These are known as the cusp. One cusp, two cusp. This one we have three. One, two, three. This is the anterior. This is the posterior part. This is where the sternum is. And this is where the vertebral columns are. Right? So this is their pericardium. Right? Right? How you are how you are able to visualize the pathway of from the right ventricle to a pulmonary artery, not the vein. This is a pulmonary vein, and this is the wall of the pulmonary vein, which are also tricuspids. Okay, so just posterior to our pulmonary vein, we have aortic wall actually. Okay, so blood, how we used to draw the diagrams. Just we have the habit of the drawing our heart like this. get into fourth chamber and the blood come from here, then it go to lungs and then collected here, then not exactly how it work. Just like this, ventricle, right? We will collect from here and from here. This is inferior vena cava, superior vena cava, right atrium, then right ventricle from here to lungs, right? From here to lungs. This, and then from the lungs, it will be collected here, back at the back also from this side, and at the from the back it will be like from here, then the drain into the left atrium, and then from left atrium to via mitral valve this part, and from here to back to our aorta, hearts of aorta, right? Also, I would like to discuss something very beautiful about our septum, especially AV septums, our interarticular septum. You know how we have one atrium here and another atrium here. This is right atrium and this is left atrium. And you know what is dividing both of them? What is between both of them? Between both of them, we have interarticular septa, which have two holes in it. One is foramen ovale, another is foramen secundum. And these holes are very important when we will discuss the coronary artery disease. I would like you to know if you can tell me which pathology is related to these foramens. There are three pathologies which are related to these foramens. Let's see who will able to find out. Thank you everyone. We will meet again.